Ralph Edward. I'm the Chief Executive Officer of the Centro Regional Medical Center. I want to just highlight you're going to be hearing from several folks today. We want to share some information with you. First up is our mayor for the city of El Centro, Mayor Efrain Silva. Mayor Silva.
Yes, thank you. Thank you, Dr. Edwards, for the introduction. My name is Efrain Silva. I'm the mayor of the city of El Centro and also a trustee for the El Centro Regional Medical Center. And I really want to thank all of you for attending our press conference today regarding a public issue that has been impacting our communities, our state, and the world. The reason for this press conference is to provide residents with information on a possible case of COVID-19. The El Centro Regional Medical Center is currently in to communicate with you that we must be prepared and most of all, do not panic. Before I introduce our health professionals that will be talking to you about this very important matter, I do want to recognize my fellow council members who are here because this is a very important issue for our community. Our Mayor Pro Tem, Jason Jackson. Thank you, Councilmember Garcia is here, Councilmember Oliva is here. Also, our city manager, Marcela Piedra, is over in the back. And also, I think our assistant chief is going to be here. Yes. Assistant Chief Commander is over there. He will be they will be also available for any questions that the public may have. But I'd like to bring to the podium or to the microphone our Chief Executive Officer of the El Centro Regional Medical Center, Dr. Ralph Edward, and also Chris Herring, EMS, the Preparedness Manager with the Imperial County Public Health Department, who will also be introducing other healthcare professionals in Imperial Valley to give you a status of the patient that has been identified and also additional information on prevention and steps that the hospital is taking to ensure that our citizens, our population is safe and is able to receive the appropriate medical care when that becomes necessary. So, Dr. Edwards.
Thank you so much, sir. We have right behind me Dr. Chris Tomaszewski, who is actually one of the trustees on the board of El Centro Regional Medical Center and professor of emergency medicine at the University of California, San Diego. Dr. Tomaszewski has been in touch with Dr. Steve Monday from the Public Health Department. They've been talking about the case and the case results. Also with me, behind me, is our Chief Nursing Officer, as well as Lou Kenny, who has been actually monitoring the case and the patient, as well as our infectious disease specialist, Dr. Mohammed Al-Jazm, and the Deputy Chief of Staff. So I'm going to turn it over to Dr. Tomaszewski to kind of describe what him and Dr. Monday has received in terms of the results on the patient, and then if anybody else will add, and I'll come back and kind of conclude, and before we turn it over to Chris. So Dr. Tomaszewski.
Hi, thanks for being here. So, in terms of introduction to this case, I want to be cognizant of the family's privacy, but there is an older female at our hospital with possible COVID. And I say possible is because we do not have our final tests back. We have preliminary results that make us worried, and therefore we're doing further analysis. We're repeating tests both in San Diego, and samples are being sent to the CDC in Atlanta. And then that will help us confirm if this is really COVID or not. I mean, this day was going to come. We all knew this. You can run, but you cannot hide in El Centro. COVID will come here, just as it has to almost every major city in the United States and in the world. The good news is, even if this case is not COVID, it means that we are well prepared because we're running through our protocols. They're running smoothly, everything's working the way it should, and we're not exposing you, the public, and our healthcare professionals unnecessarily. So everything's following the right course, the patient's getting the right treatment, and things are going as planned. So that's why I'm glad you said don't panic, because we are ready for COVID. We're already doing testing of presumptive cases. Every day people are worried that they may have COVID. They've been coming to the hospital, believe it or not. We've been testing them out in their cars, out at triage, trying to keep them out of the hospital if they're well. We don't want worried well people coming into our hospital and potentially hurting our patients with COVID. And
I wanted Lou to maybe cover a little bit about how the patient is doing. Lou?
Thank you, Dr. Edward. I can tell you that the patient is resting very well. The family is here and supporting but being isolated, and they're taking their own precautions at home. They did that ever since they brought the patient to the hospital, and whoever was in contact has been taking the right precautions. So all has been contained, and we all know who is involved in this. Thank you.
We've also been communicating with the patient families in Florida, as well as in Guadalajara, to make sure that they understand what they're going through. Borders are meaningless in this case because we're experiencing this everywhere in the world. So if you have any questions about the actual COVID virus, like I said, we do have an expert here. Dr. Al-Jazm is an infectious disease. I'll ask Dr. Al-Jazm to entertain any of the questions that you have.
Good evening. Thank you for being here. Please go ahead. Yeah, I'm going to wait for any question or any concern from you.
When do you expect results?
Well, usually we are having a turnaround time of about 24 hours to 48 hours, depending where the sample goes. Some of these samples are going to San Diego County, and some are going to the CDC.
It's already 48 hours since the patient presented.
Yeah, so we do have the preliminary result, which is not completely conclusive. Therefore, we are doing more testing just to be sure.
So the second sample has already been collected and is on its way. And I'm going to turn it over to Chris because we've been working very closely with the Imperial County Public Health Department. He's going to express to you and share with you the level of cooperation that we've been together. So Chris, over to you.
Good evening, everybody. My name is Chris Herring. I'm the Emergency Medical Services and Preparedness Manager with the Imperial County Public Health Department. I'm here today to also kind of express that close working relationship we've had with not just El Centro Regional. It's been wonderful working with them, but also the rest of our entire healthcare system in Imperial County, from private practice physicians up to the 2 acute care hospitals that we have and everything in between. It is very important for the community to know that we are working very closely with all of these facilities and all of the providers to make sure that as updated information becomes available, whether it's clinical guidance or protective measures to take for staff, visitors, patients, families, that information is distributed as rapidly and as widely as possible with all of our partners. I also do want to express that the health and safety of the residents of Imperial County is our top priority, and that's why we work tirelessly over all of these years, and particularly the last few weeks, to make sure that all of this information has been kind of gathered, analyzed, and then pushed back out to the facilities. We do realize there is a lot of concern from the community right now about COVID-19, and we want to reassure everybody here that we are working very hard to protect all of your health and safety in Imperial County.
And I want to also share with you that as of recently, we have 2 additional cases that were identified coming through the emergency room department that we believe met the criteria for COVID testing. That means we are collecting samples and have collected samples, and they will be processed like we're sharing today. We're doing this for the precaution itself to ensure that those cases that are being identified that have met the COVID testing get to actually give us results, so that we're monitoring each and every one of the signals that we know. We also have out here for you, if you'd like to take pictures or what have you, all of the sets of things that we're going through to establish communication with the public, make sure that we share information. Again, this is for the safety of the community. Internal to the hospital, and there's no need for us to bug you with all the details. We have very specific guidance that the physicians have been sharing with the nursing staff, as well as the allied health professions that are working internally to the hospital, to ensure that we actually contain any contamination or anything. So rest assured that we're following these precautionary guidelines to protect the community. So, yes, sir.
You mentioned in your brief commentary that this virus doesn't recognize borders. And we're unique right here on the border with Baja California and California, and 2 hospitals here. But the municipalities, school districts, government employees, their health plans allow their family members seek medical care either for language or familiar reasons in Mexicali? Is there a collaboration with the medical institutions in Mexicali, their hospitals, in reference to Imperial Valley resident seeking medical attention there, and yet that information may
Sure.
not be...
So let me have Chris discuss that, and I'm going to actually turn it over to the mayor to tell you what we were meeting with yesterday.
So to address your question specifically, our public health department works routinely with Baja health professionals, both at the Baja state level and at the municipal level in Mexicali. We practice routine, actually it's actual respiratory surveillance programs that are ongoing throughout the year. So not only do we have those existing programs, we've been able to leverage those relationships to maintain very good communication with the health officials across the board.
Let me just add, thank you, Victor, for the question. Let me just add that also the health professionals are taking care of health matters, but from a public policy perspective, I will tell you that we have been in close communication with the mayor of Mexicali, including a meeting that we had yesterday where we assured each other that we're in a position to collaborate with each other, to help each other out, to provide the resources that may be available and necessary. This is something that is a high level of interest, not just across Mexicali, but across the entire country of Mexico. I want to recognize Consul Tarcisio Navarrete that's here from the Consulado of Mexico in Calexico, because Mexico City is wanting information as well. Consul, isn't that correct? So this is something that is extremely important to everyone, and I really want to compliment our hospital staff, our medical staff in our hospital, because they've been working tirelessly. I think Dr. Edwards hasn't slept for 72 hours at least, staying on top of things and communicating with people and making sure that the hospital is in the best position possible to be able to address this matter. And I think for me, the issue is, the public and what the public feels. I was really concerned because I went to Costco like most of us do, and Costco is out of water, they're out of toiletries, they're out of basic necessity things, because there's a sense of panic in our community, and I'm not sure. I'm going to ask Dr. Tomaszewski to talk about this. Personally, I'm not sure that panic is deserved. That people have to be, saving water and toiletries and those kinds of things, because the fact of the matter is, at least what I have heard, is that in most cases people will be okay with this. That there's very vulnerable populations and senior citizens and the elderly and people with chronic diseases. But Dr. Tomaszewski, if you don't mind addressing that matter,
Yeah,
please.
we're seeing the same thing here and in San Diego. I mean, if we all hoard, we all lose. I mean, it's not going to work. First of all, the coronavirus has not been shown to affect pipes and tap water. Your water should still run. I can understand the concerns about supply chain issues, and we're watching that carefully, because if China's having a production problem, we won't be able to get some of our medications. So if you're worried that your toilet paper will not be made in China and shipped to you, I can understand your concern. But at the end of the day, I mean, I think China's now ramping up. They seem to have pretty good control of the virus. They even opened up Shanghai Disneyland is already reopened. So I think that should take care of itself. So I don't think we need to hoard things. I don't think it helps. But what does help is that we remember that, eventually some of us will have COVID. I hate to say that. And if you have a cough, cover it, cough into your sleeve or your elbow. Better yet, put on a mask if you're sick. The only people who should be wearing masks are those that are sick, because number one, that identifies you as ill, so keep your distance, and that way you don't spread those droplets that are infectious. And then make sure that we wash our hands. The more often you wash them, better. Soap and water works. It doesn't have to be antibacterial soap. It doesn't have to be a proprietary alcohol gel, but that's even better. But just simple soap and water will get rid of this virus. It does not live very long on surfaces, not long enough to be contagious. The way you're going to get infected is with within 2 meters, 6 feet of someone that coughs on you. That's the concern. So control your cough and watch out for others that may be coughing on you. We can contain this thing rather than just mitigate this crisis. Maybe we can keep it down in El Centro.
Take it up. There's a question over here.
Yeah, for clarification, you said there's 2 additional patients that are being treated right now?
Tested.
Tested?
Right.
Yes.
What are the qualifications that they met?
You want to clinical qualifications?
There was potential travel and no other good reason for their fever and cough. The good news is the case that we have in the hospital has probably another good reason for the fever and cough, and that's another common cold virus that in the elderly can cause pneumonia. Remember, all these cold viruses, if you're old, debilitated, or not healthy, can make any of these viruses, rhinovirus, the typical routine coronaviruses that are out there, respiratory syncytial virus, adenovirus, all those viruses are bad for people that are immunocompromised, including influenza, which is still a big killer in this country. So maybe we can use this COVID crisis as a way to control the spread of all these viruses that all kill people, especially influenza. And I think we're going to see a drop-off in all respiratory illnesses this season and maybe continue on to future seasons as we be more careful.
Any other questions? Please,
Yes, sir.
Dr. Edward, now, first of all, I'd like to congratulate you on your proactive stance.
Thank you, sir.
It's just shown by all of the professionals that you gathered today to give information to the public. I know the public is very concerned because they don't have a lot of information, and a lot of the information is being released by social